I'm Dr. Robert Lee. I've been at Waterloo Sports Medicine Center now for 20 years. Interestingly to me, the definition of what a sports medicine doctor does, I think has actually changed over the past 20 or 30 years. Certainly since I started out being a sports doctor about 25 years ago. Absolutely, it was true that 25, 30, 40 years ago, your typical sports medicine doctor looked after professional football teams, competitive varsity athletes at university. So the clinics were always known as athletic injuries clinic. If you had a sports injury, you would come to the sports injury clinic, see a sports injury doctor who would assess the sports injury. However, a lot of people that could take advantage of the expertise offered by a sports medicine doctor never really did come to sports injuries clinics because I feel they never really felt they belonged. This would be people who were running and jogging and just being recreationally active at the gym, but they didn't necessarily have a sports injury. This could also be people who were a little bit out of shape. Their family doctor told them they had to maybe lose some weight, get in better shape because their blood pressure was a little bit high, but these patients really didn't know what to do. So over the past 10 or 15 years, our National Organization of Sports Medicine Doctors, originally known as CASM, or Canadian Academy of Sport Medicine, decided to change our name to actually CASM, Canadian Academy of Sport and Exercise Medicine, to really reflect what our skill set is, that we can really help our patients with exercise advice and fitness advice and wellness advice to keep them fit and active and healthy. A sports medicine doctor like myself usually does not work in isolation. For example, at WSM, there are 3 sports medicine doctors, there are about a dozen physiotherapists, 8 massage therapists, a podorthist, a naturopathic doctor, and a brace store located conveniently right next to the clinic. A sports medicine doctor is usually a family doctor who has extra training in sports medicine. So for example, I did an extra year called a fellowship year in sports medicine. I did that training at the University of Western Ontario in London. And that was a very important year for me and for any doctor who trains in sports medicine. That year does involve a fairly intensive year of training, especially in orthopedics. So you have to be good at examining joints. You have to be good at examining a knee, a shoulder, a back. At the same time, you have to gear your assessment towards the needs of an athlete specifically. For example, athletes who are injured really are motivated to get back to their sports. They don't want to have their doctor tell them to rest for a few weeks to get that sore ankle better. They want to get back to running. They want to train. They may have something important to them. They may have a competition. And so it's up to someone like me to facilitate the appropriate assessment and the treatment plan to get them safely back to their activity. The other doctors that can become sports medicine doctors include orthopedic surgeons. Orthopedic surgeons don't only see athletes. They have to be good at, obviously, fractures. They have to be able to do knee and hip replacements and treat arthritis. A select small percentage of orthopedic surgeons are also very good sports medicine doctors. Some pediatricians also become sports medicine doctors as well. Another group of doctors that do work as sports medicine doctors are physical medicine and rehabilitation specialists, also known as physiatrists. And we have one of those specialists, Dr. Doug Dittmer. He's on staff here at Waterloo Sports Medicine Center. The type of athletes that I see as a sports medicine doctor I categorize as being obvious ones and not so obvious ones. So obviously, if you play sports, if you're playing volleyball and you sprain your ankle, if you're playing football and you have a concussion, those are a majority of athletes that I see in the clinic. That's active athletes who are playing competitive sports who get injured. The age group of these athletes, however, is not so obvious. I don't just see athletes who are in high school or in college. I'll see younger children who are just recreationally involved in gymnastics, figure skating. I'll see what I call weekend warriors, so people that are in their 30s and 40s, they're working, but they still enjoy their sports. They're playing sports or at the gym, working out. they have injuries. A large part of my practice that also may not be obvious is the number of older people that I see that are just active. They want to walk, they want to hike, they want to go on a trip. They may have an issue with their knee being slightly arthritic, but not bad enough to need knee replacement surgery. So that is what I pride myself as being something that's really important as a referral from a family doctor, how to get that active older patient better. I can assess them, I can see if some type of stability or unloading brace might help them. I can direct them to appropriate treatment, including a strengthening program and physiotherapy. I can give them very specific advice about what they should or should not do, for example, at the gym, in terms of safe activities to do or unsafe activities to avoid. When you train to be a doctor in medical school, you are exposed to basically everything. And I initially thought I wanted to actually be a cardiovascular heart doctor or cardiologist because my initial interest was in how your heart worked and how I might be able to help someone, for example, as a cardiologist, to improve heart function. Then as I got into my career in medical school, I really got more interested in the whole concept of wellness and physical activity. And the reason is, if you look at a lot of what ails people, what in medicine we call morbidity, if you look at high blood pressure, if you look at diabetes, if you look at obesity, if you look at stress or anxiety or depression, the initial treatment for a lot of what ails people is diet, nutrition, and exercise. And we should, as doctors, prescribe exercise as an intervention before we put them on medication. However, early on in my medical training, I found that a lot of my patients were not listening to my advice that you should go exercise. Some of them had very legitimate reasons to not exercise. They had an orthopedic injury, they had a sore arthritic knee, they had a bad back. So that really led me to research this area more. I did more training in sports medicine. So I do really feel that my career as a sports medicine doctor stemmed in part from my interest in helping anyone become active, anyone become fit.